Hey, good morning, everyone. It's Brad Petrella from Cornerstone. We're having a little bit of a technical issue, at least on my end. So we're going to just start out with Alethia's presentation straight off. Um, so Alethea is our broker, our carrier rep from Aetna. So if you have questions, find the little question box with a question mark in it and type in your question because everybody's in mute. So that's the best way to communicate. And Jeff or I will either stop Alethea if the timing is right, or we'll just make sure that we get them answered, um, at the end. But just know that if you're thinking of something, there's a good chance she's going to talk about it in a future slide. So just hang tight. So enough for me. Alethea, can you share your screen so we can get started?
Yes, I'm sharing. Are you able to
Okay.
see?
Um, I cannot. I'm just going to go off the camera for a second. No. Let's see what's going on here. You should be,
Yes, it says you're sharing your screen.
but you are or I am.
I am.
Okay, good. Jeff, can you see anything?
I can see the screen,
Okay,
but you're not seeing it, Brad?
I am not. So one of you brokers on the call, can you just find that question box and let us know if you can see Alethea's Aetna screen? And sorry about this. We've got to figure out something with GoToMeeting. Okay, they say they can. So Harry and Jennifer both responded. So Alethea, take it away. The floor is yours.
Great. Thank you, Brad. Good morning, everyone. Like Brad mentioned, my name is Alethia Lazarus. I'm the Individual and Family Plans Broker Manager for the Aetna, Ohio IFP market. And thank you all for having me. So today I'd like to give an overview of the IFP information that we have for 2024. Aetna entered the Ohio market for this year, so we're very excited for what we have to offer, enhancements, additional products compared to the other states. We're in 17 states currently. So, like Brad mentioned, if you have any questions, feel free to put those in the chat. So on this slide, you'll see a snapshot of what I'll be speaking about throughout the presentation. We'll talk a little bit about what makes Aetna CVS Health different. I will review our footprint and the network in Ohio. I'll also speak a little bit about some of the services we have available, a brief overview of our portfolio, and a few of our tools and resources. So, like we're full steam into the 2024 plan year. We wanted to share with you some of the important highlights mentioned on this slide. Our membership grew to over 1 million members, and we've been in the industry for 170 years. So, we're very proud of this and proud to offer a network of doctors, specialists, and hospitals in the local community. So some of the broker and member enhancements that we have that are new for 2024, starting with the IFP Marketing Studio. So this is a studio that allows brokers to customize and order marketing materials and branded promotional items. We've also simplified our traditional onboarding process to make it easier to get appointed to sell. We've enhanced our reporting capabilities and improved the access, which you will find through the site called Producer World. Our footprint continues to grow, and we have added broker managers to be state specific in the various markets that we're in. Another great feature that we added for this year is called the OTC Health Solutions Allowance. This allows members up to $100 a year on health and wellness items from CVS, and I'll talk about this a little further on in the presentation. Also, our members can access what we call the low cost, no cost CVS Minute Clinic, and that's available anywhere a Minute Clinic location is available. And along with these offerings, members also have the option for a 20% discount on CVS branded health and wellness items. So now we'll take a look at the current 2024 footprint. For this year, like I mentioned, we're in 17 states, which you'll see noted here on the slide. And for 2024, we expanded into 5 new markets, which were Indiana, Kansas, Maryland, Ohio, and Utah. So this map highlights the new state entries and also those states that we expanded into. And like I mentioned earlier, we have designated broker managers. So if you do sell in any states besides Ohio, we can connect you with those contacts who would be able to assist you further in those markets. And now we will review the Ohio market, the areas where Aetna individual and family plans is offered, and the network that is available. So in Ohio, members can utilize providers within 4 service areas, which are Cincinnati, Cleveland, Columbus, and Toledo. There is no coverage outside of those service areas except in the case of emergency. So our network breadth across our Ohio service area includes over 6,000 PCPs, over 34,000 specialists, 75 hospitals, 270 participating urgent care centers, and 49 minute clinics. So if you go to Producer World and click on the Product Plans tab on our individual homepage, you'll find a listing of the participating hospitals and also our interactive service area maps. So the product in Ohio is an HMO hybrid, which requires PCP selection, but referrals are not required to see in-network specialists. So we do like to highlight that. So we'll take a look at our service area footprint and key in-network facilities. We'll start with Cleveland here. You'll see that our individual and family plans are offered in the 9 counties noted on the slide. And the key hospitals in the Cleveland service area are University Hospitals, Summa Health, and Metro Health. For Columbus, the service area includes the counties listed here. The key hospitals would be Ohio Health, Fairfield Medical Center, Licking Memorial, and Memorial Hospital of Union. And as I mentioned earlier, members in Ohio can access in-network providers in all of our service areas, but the coverage outside of the service areas would be emergency only. For Cincinnati and Toledo, the service area includes 8 counties, which are noted here on the slide, with the key hospital system being Mercy Health. Okay, so we'll also talk a little bit about the quality experience members can receive with our IFP plans, starting with the Minute Clinic. So the Minute Clinic is a walk-in clinic at select CVS pharmacy locations. It's the largest provider of retail healthcare in the United States. So we have over 1,000 locations across 36 states and Washington, D.C. These minute clinics are open 7 days a week with extended evening and weekend hours. So if a member is traveling or has a child away at college, they can access any minute clinic to receive care. And some of the things that the minute clinics cover would be 125 minor illnesses like cough and cold, flu-like symptoms. They also can provide vaccinations at these facilities, physical screenings. They can help monitor and treat conditions such as diabetes, hypertension. They also can write prescriptions here. Most services have a $0 copay for the Aetna CVS Health IFP members. And we do have a directory specific to the Minute Clinic, which will help you locate where those Minute Clinics are available. That would be on cvs.com. You will enter the zip code that you're looking for to find the nearest location. The members can also utilize our member website and app called the Aetna Health app to manage their care. The members are able to register for an Aetna Health account using their member ID number, which is found on the ID card. It's a secure member website and app, which is available in all markets where the ACA individual plans are offered. And also the content is available in both English and Spanish. Some of the features of the app would show you your claims and EOBs for the members. You're able to download your ID card, provider and facility lookups, drug pricing, prescription retail, and additional services. So we're excited to be the first IFP carrier to offer an over-the-counter allowance to our members, which is better known as OTC. OTC is a value-added benefit focused on health and wellness. Covered members receive $25 every 3 months to redeem at CVS locations. And this allowance can be used in the store, online, over the phone. Members will have access to an in-store catalog, which will show about 900 items to choose from. The Aetna IFP members in Ohio receive an ID card that combines the medical, pharmacy, and retail benefits included in their individual and family plan. And the ID card includes a magnetic strip on the back, which allows members to use it in store to receive a 20% discount on CVS Health brand items. So we also want to note with that feature, though, that cannot be combined with the OTC allowance. Okay, we'll take a closer look at the individual and family plans. So some of the features included in our plans would be the $0 CVS Health Virtual Care, which is available on all plans, the $0 Minute Clinic visits, the over-the-counter health solutions program. We have a Tier 1A RX benefit, which does not apply to the CMS standard plans. Our members must use network providers within the service area. Out-of-network coverage is available for emergencies only. And our portfolio includes 1 gold plan, 3 silver plans, 2 bronze plans, in addition to the CMS standard plans, where we have 1 for each metallic tier. So the plans are offered on and off exchange. The CMS standard plans include an S in the plan name. The plan deductible and maximum out-of-pocket amounts are embedded, which means no one person will pay more than the individual amount. The deductible and maximum out-of-pocket are integrated between medical and prescription. All of the plans, including the HSA compatible plan, will include pediatric vision and hardware at a $10 copay with the deductible waived. Outpatient visits for mental health or substance abuse follow the PCP copay. The pharmacy network is our managed network, which includes over 52,000 participating pharmacies. And some of those pharmacies include CVS, Walmart, Kroger, Sam's Club, and Costco. One of our more popular plans is shown on this slide, the Silver 594. Some of the features are noted here: $0 deductible, $0 PCP, $0 for the walk-in clinic, $15 specialist, $5 for urgent care. The plan here includes copays for low-cost generic and preferred generics, with the copay on the Silver 94 being $0 for both low-cost and preferred generics. So in order to view the entire portfolio, that would be found on Producer World. So again, that would be going to the individual homepage and clicking on the Product Plans tab, where you'll find our detailed benefit grids for the Silver, Gold, and Bronze plans, which do include the CMS standard plans. So here I just wanted to highlight currently the top 5 bestsellers in Ohio, with number 1 being the Ohio Bronze 4. then followed by the Bronze 2, HSA, the Bronze Standard, the Silver 5, the Silver S. And on the right side here, you'll see a snapshot of Producer World, where you'll see in about the middle of the page, that's where you'll find the benefit grade for 2024, which is available in English and Spanish. Also, you'll find the SBCs. This will also take you to the pharmacy search and a few of our other features, including flyers such as the over-the-counter catalog that I mentioned earlier. So we'll talk a little bit about some of the broker services. As I mentioned earlier, one of the things that we've done is simplify the appointment process. So we call that our ready to sell requirement. If you're not yet appointed, there are 3 key requirements. So you would want to visit Aetna.com, navigate to the Explore Aetna sites in the drop-down menu. You will click on Join Our Producer Team. There is an appointment application that you would complete. After that's completed, you're able to upload your FFM or state certification.
And Alethea, I just want to jump in here. In
Yes,
order to get appointed, let Brad or myself know first, because we actually do this internally. So you don't have to go out to Producer World and do all that. We'll do it. We'll get the ball rolling for you. So be sure to contact us.
perfect. Thank you, Jeff. Okay, and here also highlights Producer World. So there are various tabs where you can find things such as our ready to sell, the quote and enroll, which will take you to the portal, the renewal information. We also have what's called the broker toolkit. That is where, again, you'll find your service area maps, marketing materials, newsletters, and this site is updated very frequently. So you check back there for any new information, new marketing materials, and things of that sort. Also here, you'll see the compensation tab. You're able to view statements and access reports. And as I mentioned earlier, the IFP Marketing Studio. So this is brand new for this year. So when you visit the site, you're able to download digital and print files. You can order printed materials. You can order promotional items, which right now we have things like pens, bags, Post-its, ship clips. Additional marketing materials will be released as they become available. And also information highlighting new member benefits can be found in this studio. So if you are looking for any of our broker bonus program information or commission schedule information, this is all found on the Producer World. That individual tab will house all of that information and is updated when there are any changes. Here also, I'd like to just highlight some of our contact information, some of the departments that may be helpful to you, such as our broker services unit. We have a Producer World help desk. We have our licensing team, and we also have our commission team, which you can either email or call. And also our member services and billing is found on the right side of this slide. This
And
information
please,
is also found on Producer World.
and by all means, don't hesitate to give us a call when it comes to commissions. We do a lot of that here at Cornerstone. So give us a call first, if you wouldn't mind. Thanks.
Mhm. Okay. And just to wrap up, a few of the things that we mentioned. For Aetna IFP, we're currently in 17 states. Our OTC feature allows for up to $100 for our members to utilize at CVS locations. There's also the 20% discount available to members, not to be used in conjunction with the OTC. And the Marketing Studio allows you to order personalized and branded items. So thank you all for your time. And that concludes the IFP for Aetna.
That's great. Thanks, Alethea. Let's just see if any questions start rolling in. While they may be typing up some things, let me ask. I know it's way too early, um, but do you think there may be any additional county expansion in Ohio for 2025?
I know it's being reviewed currently, actually, so we
Yeah,
haven't received any word. We should have that though within the next coming months, typically just prior to open enrollment that's released.
right, right. Yeah, and then we're going to have you back on another training in August, September when we know. What's going to be happening for 2025 with Aetna. So hopefully
Yes,
will be good things. Jeff and I need to
yes,
start scheduling those.
that would be great.
Yeah,
That would
exactly.
be great.
I'm not seeing any questions come in yet. Jeff, do you have any
No,
questions that
no,
you thought of?
I just want to reiterate when it comes to appointments and commissions, that's done here at Cornerstone. So give us a call first, and that's what we do. That's our value add. We do a lot of that stuff and a lot of legwork for you. We think this Aetna product is fantastic. I mean, all these added features, including the OTC feature, really help them elevate. And it's just a great addition to your portfolio. So,
Agreed.
that's what I had.
That's great feedback. Thank you, Jeff. And yeah, like I mentioned, the catalog is available on Producer World for anyone that doesn't have that, which will show you those 900 items. And we do have a few flyers that speak to the feature as well.
Alethea, I
Great.
did think of one question, and this is becoming a more common ask of carriers. Do you have an off exchange product?
Yes, yes. So all of these plans are available on and off exchange.
Okay, we're getting more and more
So
people wanting the off exchange
yes.
channel.
So on Producer World, we do have our SBC, and in the SBC, there is a plan ID. The plan ID basically will identify whether it is an off exchange or on exchange plan. So essentially, all of the plans that are available on exchange can be found off exchange. The one caveat is that we do offer pediatric dental, which is only available on the off exchange plans.
So brokers will be enrolling the off exchange on Producer World. Is that
Yes, so through Producer World, that will take you to our broker portal
uh-huh.
where you're able to enroll directly for those off
Okay.
exchange plans.
And if I'm not mistaken, the on exchange, you've got it set up through Health Sherpa, right?
Yes, yes, that is available. Um, healthcare.gov, you are able
Hmm.
to navigate the plans as well. Hmm.
Yeah. So,
Perfect.
but we emphasize that agents use Health Sherpa because it's more of a broker driven
Yes, exactly.
platform. And that's another thing we do here at Cornerstone. We set you up with Health Sherpa. So we'll add Aetna for Health Sherpa for you so you can sell on exchange. And we can walk you through that whole process.
That's excellent.
Perfect. Well, I think maybe, wow, this might be the quickest training we've done, which is good because the information is pretty straightforward with Aetna. So, the CVS Minute Clinic, I think, is great in the era of quick and immediate service. And Alethea, they can make an appointment to go to the Minute Clinic, correct?
Yes.
Okay, I
Yeah.
thought so because
Yep.
I think we used it in my house one time. Um, so yeah, that's if you know that you have a child and you want to take them, or your clients have a child and they want to take them, that's an easy thing to schedule after school. So if it's not an earth-shattering condition. So anyway, well, that's good.
Yes,
I don't want to hold anybody up. Alethea, any last parting words?
just the last thing with those minute clinics, like I mentioned, there is a locator specific to the minute clinic. So there is a link that will take you there where you can put in your zip code to find those closest to your area. But again, the minute clinics are national. So that's one of the great features about that.
Okay, great. And Gary's asking, where are the pictures? Am I missing something? Unless Gary really
We have
wants
her
to.
presentation turned off.
Oh,
So
oh, okay, got it.
we just have the blank screen. So everybody will get a
Okay,
copy of this presentation in a follow-up email, and it'll also be archived on our resource page on our website. So don't fret if you miss something; it'll all be out there.
yeah, the recording as well will be available on the Resource Center too. So
Yeah.
all good things. So great. Jennifer, you're welcome. It's always nice to get favorable comments or reactions. So thank you for that. Everybody have a great sunny day here in most of Ohio, I believe. So enjoy tonight. Brad and family will be enjoying our son's high school graduation. So a big deal at my house. Actually, it's been kind of whirlwind kind of last past week. So anyway, everybody take care, and we will see you again. We've added a few. You'll probably be getting an email for a few other carriers in the upcoming few weeks. Not, we're going to take a break next Tuesday because nobody will want to join a call at 9:30 the day after the Memorial Day weekend. So we're going to give you a pass on that one. So we'll see you back. I believe it's on June 4th for our next carrier training. So Alethea, thank you so much for always being kind enough to want to join and help our brokers. So anyway, everybody have a great day, great rest of the week, and we will see you next time.
Take
Take
Thank you
care.
for
care,
having
everyone.
me.
Thanks. You're welcome. Bye.